Imagine the terror, a Roman legionary, struck down in the chaos of battle, blood gushing from a grievous wound. No emergency room, no MRI, no morphine. Just the raw, visceral reality of ancient warfare. In this brutal world, a broken bone or a deep laceration usually meant a swift, agonizing death, or a life forever marred by disability. Yet, against all odds, the Roman army developed a system of battlefield medicine that was not just surprisingly effective, but shockingly advanced for its time. They performed complex surgeries, managed infections, and saved countless lives, all without the modern marvels of anesthesia or antiseptics. How did they achieve such feats in an era defined by primitive tools and rudimentary knowledge? This is not just a story of survival, it's a testament to human ingenuity in the face of unimaginable pain and peril, a forgotten chapter of medical history that redefines our understanding of ancient capabilities. The backbone of Roman battlefield medicine was the valetudinarium, a military hospital far more sophisticated than anything seen before its time. These were not mere tents but purpose-built structures, often with multiple wards, sanitation systems, and even designated operating rooms. Each legion, comprising around 5,000 men, was typically accompanied by a dedicated medical corps, including surgeons, physicians, and assistants, known as medici. Their primary objective wasn't just to treat the wounded, but to return them to active duty as quickly as possible, minimizing troop losses. This pragmatic approach fostered innovation and systematic training, elevating military medicine to a standard that often surpassed civilian care. The Roman surgical kit was remarkably comprehensive and recognizable even to modern eyes. Excavations have unearthed an array of instruments, scalpels made of bronze or steel, bone drills, forceps for extracting arrowheads, catheters for bladder issues, and even speculums. These tools were not crude implements but finely crafted instruments designed for precision. For instance, the cautery iron was used to stop bleeding by searing wounds, a painful but often life-saving procedure. The design of these instruments suggests a deep understanding of anatomy and surgical principles, allowing Roman surgeons to perform intricate procedures that sound almost unbelievable given the lack of anesthesia. Without anesthesia, pain management was a brutal reality. Roman surgeons relied on swiftness, skill, and sometimes, a strong dose of wine or opium as a mild sedative. Patients were often held down by several men, enduring excruciating pain during procedures like amputations or bone setting. The mental fortitude of both the patient and the surgeon was paramount. Despite the horror, the surgeon's focus was unwavering, to save the patient's life and limb. Their reputation depended on their success rates, pushing them to master techniques that minimized trauma and maximized efficiency, even if the patient's immediate experience was agonizing. One of the most common and critical challenges on the battlefield was wound care. Roman medics understood the importance of cleaning wounds to prevent infection, though they lacked the germ theory. They used various methods, boiling water, vinegar, or even wine to wash wounds. After cleaning, wounds were dressed with linen bandages soaked in substances like honey, a natural antiseptic, plant extracts, or even spiderwebs. They also recognized the danger of deeply embedded foreign objects and developed specialized instruments and techniques for their removal, knowing that leaving them in could lead to festering and gangrene. Amputations were a last resort but a relatively common procedure for limbs damaged beyond repair, such as those shattered by projectile weapons or suffering from severe gangrene. Roman surgeons performed these with surprising speed, using a sharp saw to cut through bone and a cautery iron to seal the remaining blood vessels, preventing fatal hemorrhage. The survival rate, while certainly lower than today, was not insignificant, especially if the procedure was performed quickly and skillfully. This speaks volumes about their anatomical knowledge and practical surgical expertise, operating under immense pressure and without any form of pain relief for the patient beyond sheer brute force. Roman doctors were also adept at treating fractures and dislocations. They understood the principles of reduction, realigning broken bones, and immobilization. Splints were commonly made from wood, woven reeds, or even hardened leather, often padded with linen. They would carefully manipulate the bone back into place, a procedure known as setting the bone, and then apply the splint to keep it stable while it healed. This meticulous approach minimized long-term disability and allowed many soldiers to return to duty, a testament to their practical understanding of musculoskeletal injuries and rehabilitation. Beyond immediate trauma, Roman medics also dealt with internal ailments and infectious diseases, which were rampant in crowded military camps. They understood the importance of basic hygiene, advocating for clean water sources, proper waste disposal, and regular bathing, a stark contrast to many other ancient societies. They also had a rudimentary understanding of diet and exercise for maintaining soldier health. While they didn't understand germs, their practical measures often had the effect of reducing disease transmission, showcasing a holistic approach to military well-being that extended beyond just treating battle injuries. The medical corps of the Roman army wasn't an afterthought, it was a highly organized and essential component of their military might. Doctors, though not always high-ranking officers, were highly respected and well compensated. Their training was rigorous, often starting with apprenticeships and continuing with practical experience on the field. This systematic approach to medical education and professionalization ensured a consistent standard of care across the vast Roman Empire, directly contributing to the longevity and effectiveness of their legions. It wasn't just individual brilliance, but an institutionalized commitment to medicine that made them so successful. Perhaps one of the most astonishing aspects was their ability to perform forms of neurosurgery, specifically trepanation. This involved drilling or scraping a hole in the skull, often to relieve pressure from a head injury, remove bone fragments, or treat certain neurological conditions. Evidence from ancient Roman skulls shows signs of successful trepanation, with bone regrowth indicating the patient survived the procedure. While incredibly risky and agonizing, these operations demonstrate an advanced understanding of intracranial pressure and a willingness to undertake extreme measures to save a life, pushing the boundaries of what was thought possible in ancient surgery. The impact of Roman battlefield medicine extended far beyond the battlefield. Many of the techniques and instruments developed by military medics found their way into civilian practice, elevating general medical standards. The systematic organization of medical services within the army also laid groundwork for future hospital systems. Their detailed medical texts, though many are lost, influenced later physicians like Galen, whose writings dominated Western medicine for over a millennium. The Romans, through their pragmatic pursuit of military efficiency, inadvertently advanced the entire field of medicine, leaving a legacy that continues to resonate. Despite their incredible achievements, Roman medicine was not without its limitations. The lack of germ theory meant infections were still a major killer, even with their hygiene efforts. The absence of effective pain relief made every surgery a test of endurance. Yet, their practical, results-oriented approach, coupled with skilled practitioners and well-designed instruments, allowed them to achieve remarkable success rates for their era. They operated in a world where the line between life and death was razor-thin, and their ability to consistently pull soldiers back from that brink is a testament to their enduring legacy. The story of Roman battlefield medicine is a powerful reminder that human ingenuity, perseverance, and a systematic approach can overcome seemingly insurmountable challenges. These ancient medics, working without the luxuries we take for granted today, pushed the boundaries of what was medically possible, saving lives and shaping the course of history. They prove that even in the most brutal of circumstances, the pursuit of healing and the mastery of skill can lead to astonishing breakthroughs. Their legacy is a testament to a forgotten era where stoicism met science, and surgery without anesthesia truly worked. What aspects of Roman medicine surprised you the most? Share your thoughts in the comments below, and don't forget to like and subscribe for more journeys into the untold stories of history.